There's a new children and adolescent psychiatric unit at the University of Maryland Children's Hospital, and it is aimed at helping young people with a broad spectrum of mental issues. And joining us this morning with more on that new unit is Dr. Jill Rockbeisel. Good morning, and thank you for joining us.
Good morning.
This is really a first of its kind in the state because you're offering trauma-informed care to these kids. Can you explain to people what that means?
Trauma-informed care is a way of providing treatment in such that you don't re-traumatize children. It's really focused on providing an environment, family involvement, and programming that helps a child regain self-control, develop good coping mechanisms, and heal. It's also a way of getting upstream and dealing with severe traumatic issues that, if not addressed in children and adolescents, goes on to display problems in adults.
And you're dealing with kids 5 to 17, really referred from all over the state. What types of conditions are you helping to treat? And can you describe to people sort of the average length of stay and what your role is to do there?
So we treat all kinds of emotional and mental health issues. The ones that people frequently hear about, which is depression, anxiety, bipolar disorder, but also children and adolescents that are suffering from post-traumatic stress disorder. Our role is along the lines of helping children and adolescents provide or establish better attachment, develop better coping skills, and really importantly, develop self-regulation of their emotions and awareness of when they feel like they're going to lose control.
How do you do this so quickly? Because from what I understand, the average length of stay is really just about a week. So are you more trying to stabilize a situation and then refer them to more care after they leave your facility?
Both of those things, yes. The way that it's quickly implemented is, it's just the beginning, you're right, but it's family involvement, and it's demonstrating on the unit appropriate interaction, both child's reactions, parents or family reactions to that child. So you're really working with caregiver regulation as well as children and adolescent regulation in their emotions. We involve families from the very beginning. We really, I think, are the first unit in the state where we permit a parent or a guardian to stay overnight with a child if that's what's important. If a child is suffering from severe separation anxiety and really significant attachment disorder, then having that family stay is really an important component.
And you guys have only been open, I think, less than 2 weeks, if I'm right, and already you're more than half full. And according to one doctor we spoke with, most of who you're dealing with right now are teenagers, and you're really seeing the effects of the pandemic.
Absolutely. We've always had problems in our state and actually nationwide with adolescents needing acute care and held up in emergency rooms. With the opening of our new unit, we've gotten a lot of adolescent referrals, particularly during the pandemic when they're isolated, they're away from their friend groups, they don't have that really important developmental stage of peer interaction. There's just a lot of emotional upheaval and a demand for that age.
Well, and speaking of that, you have the 16-bed facilities, and most of your clients then come from referrals. But if families are watching this and they're thinking that this could be a really good place for their child, what can they do to learn more?
They can actually call our Psychiatric Assessment and Referral Center, which is 410-328-6321. It's a place where they can be then connected up to talk with the right person to give them information. They can also talk to our psychiatric emergency center, where we have people 24/7 that can take calls.
And in many cases, sometimes families are finding themselves in an emergency situation. They might be at an emergency room with their child who has tried to self-harm. In that case, do they say, hey, I heard about this new facility. Is this something you can check out? Maybe a place for my child?
Absolutely. And that emergency room can call our, again, park officer, RED, and we will facilitate a transfer if that's what the child needs, parent wants, and we have room.
Wow, such an important service coming at just the right time for so many growing needs of young people in our state. Thank you so much for joining us this morning. Really appreciate it.
Thank you for having me.